Flights from South Africa and other countries have been suspended following the detection of a new COVID 19 variant abroad. The Philippines sees over 800 fresh COVID 19 infections, the fourth consecutive day of less than 1,000 cases across the country. And the National Task Force Against COVID 19 is now gearing up for the national vaccination days next week and another one next month. Fast, focused, and fearless. Here's a roundup of stories we're watching now. I'm Riza Diaz. The Philippine government suspends inbound international flights from countries with reported cases of the Omicron COVID 19 variant. These countries are South Africa, Botswana, Namibia, Zimbabwe, Lesotho, Eswatini, and Mozambique. Now, the suspension of flights from these countries is effective until December 15. The health department says stricter border controls and compliance to protocols are needed to address the threat of the new variant. In an interview with One News, Secretary Francisco Duque III said that Filipinos have to be compliant of the minimum public health standards. He explained that this is the most effective way to combat the virus regardless of the variant.
Whether it's an alpha, beta, delta, kappa, or omicron variants, it has been proven time and again that the minimum public health standards are effective. So all of these we need to do, and we've been doing this, in fact.
Although the number of cases wane each day, Duque warned anew against complacency. He pointed out that another surge may happen in the Philippines, just like in Europe, even if or even as we continue to ramp up our vaccination efforts.
We are looking at and hoping that if there's going to be a spike, which is a possibility, as you can see, in Western Europe, and that may very well happen to us. So we need to be careful, and of course, the vaccination is one of the key solutions to responding to the COVID-19 pandemic, whatever the variant.
Now, to further discuss the recent developments related to Omicron variant, we have with us research fellow from Octa. We have Professor Guido David joining us via Zoom. Sir Guido, good evening.
Hi, good evening, Riza.
Mm-hmm. Sir, what are your thoughts about the government's move first to impose restriction or rather suspension of inbound flights from South Africa and other countries?
Yeah, we like that decision. It's very proactive. We actually did call for an escalation of quarantine restrictions after we heard about this new potentially threatening variant just a few days ago. So in fact, we imposed the travel ban on the same day that the United Kingdom and many other countries imposed a travel ban from South Africa and many of the nearby regions in South Africa.
Mm-hmm. So do you think this move is showing that the government actually learned from the Delta variant?
Well, yes, definitely, and we should learn. We should be vigilant. We should be more proactive. Even as for example, the World Health Organization itself stated that they don't encourage issuing travel bans, but many countries, including ours, issued travel bans anyway. So right now the Omicron may not be as bad as we think it is, but we don't know. So it's better to be safe than sorry, so to speak.
Mm-hmm. So given the data that we have, how do you think this and when do you think this will affect the trend of COVID-19 cases in our country?
Right. It depends on when a variant manages to come in the country. if we're looking at the past history, last year the alpha and beta variant first became known around December, November, December. So it seems possible that only if, I mean, I have to frame it precisely, that if this variant is as destructive as it potentially is, and it somehow manages to get in our borders, we may be seeing a surge sometime around February or March, heading into the election, and that would be unfortunate.
Mhm. But sir, so far the numbers are dwindling as to number of cases. Do you think this will persist perhaps in the next coming week, and will it last perhaps until the holiday season?
I think our holiday season is safe for now, so I don't think we have a lot to worry about that. So we have preserved essentially the fourth quarter, but we will be worried about what will happen next year. But there's still time. We will be monitoring this new variant, this Omicron variant, which has been detected just recently in November 9. So we will know more about if it is indeed more infectious, if it is resistant to some vaccines, or if it has some vaccine escape. And then lastly, if it causes more severe illness. So we don't have any of that information yet because it's new, and we don't have sufficient number of cases to check for the statistics. But once we know more, we will have an idea if it will really affect our numbers next year. Most likely next year. I don't think it will affect things this month, this December.
Mhm. Professor, last question. Given what we know already of this new variant, do you think Metro Manila is ready to be downgraded to alert level one?
Well, I think it's possible to downgrade to alert level one. It's the decision of the IATF and the Department of Health. They base it on certain metrics, but at the same time, I actually wouldn't mind, remaining at alert level two, just because of the potential threat of this new variant, which we don't know. I mean, Hong Kong already had a report of this new variant, and it's barely possible that it has already come in through some back channels, through some other countries, maybe not through South Africa, because it's also been reported already in Belgium, and travel is fairly open right now. So just to be a little on the safe side, but yeah, I mean, right now situation is still good inside the country. So if they decide to go with alert level one, I wouldn't mind it either.
All right. Thank you, sir, for always sharing with us your time and your insights. That's Professor Guido David of the Octa Research Group.
Thank you, Riza.
Now, the target vaccine administration for the national vaccination days has been due or lowered due to logistical challenges. Now, from 15 million COVID-19 doses for the activity set from November 29 to December 1, the target is now adjusted to 9 million jabs. The National Task Force Against COVID-19 explained that the country currently lacks ancillary supplies like syringes. NTF spokesperson Restituto Padilla told One News that they are mulling for another 3-day vaccination drive mid-December. This is in an effort to achieve their goal of inoculating 54 million Filipinos by year end.
We have set another 3-day vaccination campaign middle of December, which will have the same and similar number of inoculation targets. So essentially, these two combined will allow us to be able to come out with about 18 million target inoculations for the whole 6 days.
Now, over 800 fresh COVID-19 infections were logged today. This brings the total caseload to 2.83 million, 17,000 of which are still active. At least 7 duplicates were removed from the case count. Now, 188 more people died of the virus, pushing the nationwide death toll to more than 48,200, 156 of which were just reclassified from recoveries after validation. Survivors, meanwhile, are now at 2.76 million, with over 1,600 new recoveries logged today. 2.4% of some 37,200 people recently tested for COVID 19 turned out positive. NBA superstar LeBron James finds himself in another trouble. The Lakers forward received a $15,000 fine for using an obscene gesture against Indiana Pacers on Wednesday. James just returned to the hard court after being suspended for striking back the Detroit Pistons center Isaiah Stewart. Now, for more updates, visit News 5, the Philippine Star, and Business World Online. Visit our website, onenews.ph, for more in depth analysis. You can also catch One News on Signal Play app. Register for a free account now, www.signalplay.com, and stream One News live anytime, anywhere. I'm Riza Diaz. Mask on, wash hands, and stay safe, Philippines. We are One News.